Aaron Beck. It's a beautifully done book. So here's where we're going. Who, what, where, when, why, how, all this stuff we're going to be like a little overwhelmed with as we begin to engage in treating these patients, because there's so many factors in understanding what's going on and then kind of trying to formulate a treatment package that is actually going to be effective. So what are the knowledge domains that we want to take a look at, and we will. So we want to be able to do some kind of diagnosis, and I'm going to use that word loosely. I'm not saying that diagnosis is DSM, and you'll see why in a minute, and then some kind of case formulation. I try to do that in the first session or first two sessions. I often encourage people to come in for a 90-minute session for the first session. Insurance companies now, many of them reimburse for extended sessions. People, we know how to use these schema as a way of mapping the person's intrapsychic, interpersonal, and family system, and to help use these tools as a way of understanding what from the past needs to be healed so that they can have more fulfilling current relationships, more abundant life, and that their expected relationships won't be based on their antiquated schema. So these are very powerful pattern recognition tools. Let me see what time it is. We're going to keep going, and then we'll have a couple minutes before we break for me to take some questions. Unless you want to ask some as we go, again, feel free to do so. I also want to talk about a few concepts that are, I think, really essential, have been a great deal of help to me. Many of you probably have heard these. It's helpful to read the book by Pressman and Pressman called The Narcissistic Family, because a lot of times these narcissistic personality expressions can be in a covert form. And what I mean by that is the narcissism does not appear to be, the grandiosity does not appear to be that, I'm gonna go out and be the president. I'm gonna be the best actor in the world. It really has to do with avoiding anything that is actually going to expose them, and also bringing a lot of attention to themselves because of their often extreme avoidance. So this is a young man who has all these difficulties, and where to start with him has been a real complex situation, because clearly in his case the main issue is the personality function. Was about when he was about 14, he felt like he was a brilliant young man. He actually, what he said to me was, I had so many gifts and did not want to live as an average person. And he was not able to consistently work over the course of his life. But he had developed, so his grandiose, he had a brain trauma when he was about 14. He was in the grandiose phase of his development. He got stuck in that phase of development, and then he developed all these protector parts, a la IFS Schwartz. So he had this, whenever he failed and he couldn't live up to his grandiose aspirations, he had an abusive part that would come in, and he would talk about himself in the most disparaging,